A positive development in the past several days is the end of the outbreak at the Misericordia Hospital, which was declared over on August 14th. That hospital is implementing a phased approach to return to normal operations. Some other developments that I want to flag are the quick actions of Covenant Health and Alberta Health Services to respond to a situation where a staff member tested positive over the weekend at the Grey Nuns Community Hospital in Edmonton. The staff member had been working on a unit that was caring for 3 people who had tested positive with COVID-19 acquired in the community, not at the hospital. Covenant Health closed the unit to patient transfers and discharges, took additional patient precautions, limited visitors to exceptional circumstances only, and has been performing enhanced cleaning. Other developments over the weekend arose out of a religious gathering in the hamlet of Deadwood near Manning and north of Grand Prairie, and a second development at the Bible Pentecostal Church in Edmonton. The It Is Time Canada religious gathering in Deadwood took place over the August long weekend. This is a good reminder that identified cases often are the outcome of activities that happened up to several weeks before. The gathering resulted in 15 lab-confirmed cases in Alberta and 17 in British Columbia so far, and it is likely that we will be identifying more. An estimated 200 to 300 people attended over the course of the 3-day gathering. We are working with BC Health to ensure that contact tracing is completed for all those who attended. I want to ask that anyone who attended the event in Deadwood between July 30th and August 2nd, or who was a close contact of someone who did attend, should book a COVID-19 test online through Alberta Health Services and continue to monitor for symptoms. Also, in an unrelated event, despite precautions being taken during in-person services, there are now 15 confirmed cases linked to the Bible Pentecostal Church in Edmonton. The church has about 150 members. Anyone who attended the church between July 26th and August 12th, or who was a close contact of someone who attended, likewise should book a COVID-19 test online and continue to monitor for symptoms. It is a stark reminder that coming together in large gatherings risks sharing more than fellowship. It risks sharing the COVID-19 virus. It is critical to not stigmatize those who test positive or those who have come in close contact, as we do not want to discourage people from being tested. Instead, we need to take this as a reminder that all of us have to follow all measures tenaciously, even if we are tired of washing our hands, wearing a mask, and not being able to hug the people we care about. We must all keep following public health advice if we are to continue to flatten the curve and protect our friends, families, neighbors, and communities. Turning to today's numbers, we identified 89 new cases in the last 24 hours. There are now 1,169 active cases in the province. Currently, 48 people are in hospital, including 11 in intensive care. Tragically, I am reporting 1 additional death today. My heartfelt condolences go out to anyone who has lost a loved one, whether to COVID-19 or any other cause during this pandemic. The lab has completed more than 8,000 tests in the last 24 hours. We expect to add thousands of tests to this total this week and next. Under a new agreement with Alberta Health Services, within the next 2 weeks, all 234 Alberta-based affiliated pharmacies in Loblaw-owned stores will offer COVID-19 testing. The Loblaw family of stores includes such familiar names as Superstore, Wholesale Club, Extra Foods, No Frills, Independent, and Loblaw City Market. Thank you to Shoppers Drug Mart and Loblaw for making testing highly available in every community, including, and maybe especially, outside of the big urban centres. Overall, it increases Alberta's testing capacity by about 3,000 to 4,000 tests a day.